Hey YouTube, another update. I'm getting past the year mark now, but again, as I mentioned, this video and these last several are my 1 year post TIF and hiatal hernia repair specifics. I've done one on diet and medications, and I guess I'll do one real quick on symptoms. I've kind of mentioned that. I mean, they overlap, of course, but again, initially, when I first started having symptoms, and again, I've been having symptoms of reflux for many years, but it was minor 10-15 years ago. You have an alcoholic beverage or whatever, maybe too late, or something spicy at night or whatnot, and it just got to you, and you just like, oh man, that heartburn, and then you take a Tums or Rolate or Zantac or whatever it might be, and it goes away for the most part. But it wasn't until, again, about summer 2020, spring, summer 2020, April, May, June, something like that, I don't remember exactly, of 2020, when I started just have to awful worsening symptoms. For me, the heartburn wasn't the problem. I started because I was used to heartburn, and I had had episodes sometimes like going on a work trip, coming back, and then having pizza. This was on a Friday night, I remember it, having pizza, and then just feeling that awful heartburn, but for days it just wouldn't go away. I couldn't sleep, and anxiety made it worse, but it was just awful. And this was, again, 2018, 2017, something like that. And again, it wasn't until, again, Friday night into Friday night, Saturday, Sunday into Monday, not till Tuesday, where I really started to feel like I feel more back to normal. But it wasn't, again, until spring, summer of 2020 where I started having, for me, was worsening symptoms, which was nausea, water rash, which is excessive, like you wouldn't believe, excessive saliva, to the point where I felt like I was chewing tobacco and I had to spit every 2 seconds. I literally had spit cups. I had a cup or a water bottle, and I'd spit my own saliva in there, and I wasn't chewing on anything, nothing. And then water was sour water taste, so the nausea was pretty crippling at points too. So it's hard to focus when you're nauseous all the time, and then when you need to spit every second, and you're spitting into it, it's just awful. And then I like water, and I drink a lot of water. Water's good for you. It's nature's fruit juice. Water was just awful, disgusting. So that went on for a long time, and then in addition to that, I had throat. My symptoms were not heartburn down here, in the chest, nipple line down, and in the chest area. Mine were like above the clavicle here. It was almost throat. I think, again, they diagnosed me, misdiagnosed me, I don't know, but I think I didn't necessarily have an acid reflux like the common things you hear of. I think I had a laryngopharyngeal reflux, an LPR, where the burning was more in my throat. I felt like I was drinking salsa all the time, and it just would stay right there in my throat constantly, and it just was awful burning. And I don't think I mentioned this in the last video with medications, but I don't know if this is a medication or not, but I did the baking soda and alkaline water spray. I drank alkaline water. I swished with the baking soda, alkaline water. Find it on YouTube, Google it. It's there. People have done this. I'm not the only one, but helped and didn't help, depends on the situation. Then I also cough drops. Cough drops help. Really helped me, because I couldn't be spraying all the time. So even with the water rash, the excessive saliva, the cough drops help get the saliva down, that was otherwise disgusting. So, but yeah, throat burn, nausea, water rash, sour water taste. I felt like when I laid down, especially, I couldn't lay down, and it just caused me to have I felt like, in a way, and I guess this makes sense, you can research it, of course, that the acid would, you know, with gravity come up here, and when I laid down, it'd get into my eustachian tubes, even in my nose, and I, you know, had an ear issue at a point. So, but again, if you're watching this video, I took a PPI for a short time and then I stopped. But go back and watch the medication video if you want to know more about that. But those are the things I did and the symptoms that I had. And then couldn't take it anymore. Okay, fine, surgery. They okayed me for surgery. I had, again, 3 centimeter hiatal hernia. And they did the repair, pulled the stomach down, hiatal hernia repair, and then the TIF. You know, look up the TIF, TIF, if you aren't sure what that is. And July 2021, and a year later, I have symptoms here and there, and again, from other issues I've had with concussion, with nausea. I think it's concussion nausea, not hernia nausea or reflux nausea. My symptoms now, I really don't get throat burn ever. Recently I have, I think, a little bit, but it's not anything to speak of, I don't think. Water brash, extremely rare. Nausea, again, gone, other than the concussion. But again, that's nausea from something else, not from the hernia. So I just, you know, if I have something odd in terms of diet, and again, go back and watch the diet video if you want to know what the diet's like now. I'm asking for it. You know, I'm getting older. I'm 42, so I'm not old. I'm very young. However, I'm not 21 anymore. I can't just have a green chili burrito and a couple beers and then finish it off with some nachos and chili dog. I just can't have that. You know, you're asking for it. So, you know, if I'm not as cautious as I was, of course, but I mean, I can. And again, watch the diet video. But I don't really have very many symptoms. Oh, pressure, where they did the hernia repair. I mean, my rib cage, the bottom of my rib cage, I mean, my, you know, the stomach coming up here, I guess, wherever it comes up. And I get pressure in here. And I've had a stabbing lately, and I don't know what that's about. But I asked the doctor, the surgeon that did the hiatal hernia repair, and the nurse got back to me and said, so, you know, he's on vacation, and, you know, he'll get back to you if he thinks it's concerning. And he never got back to me, and that was like 2 months ago. So, yeah. But otherwise, I just really don't have very many symptoms other than the common acid reflux symptoms that you'd have, I guess, and for me. But I don't get nauseous from food anymore. I don't have the water brash anymore. I don't have sour water taste anymore. I don't have that kind of stuff. So my symptoms are relatively, again, under control, and I have symptoms maybe 5% of the week versus 95% of the day. So, I mean, it was just certain days that were just constant nausea, water brash, sour water taste, throat burn, all the symptoms that I had. And I think there's others I just can't remember. But all the symptoms are relatively under control. But those are the ones that were the worst. Was the, I guess, excuse me, regurgitation, I think. But that one's I don't think was a major one. So I'm not even sure if I can describe what regurgitation is, because it wasn't one of the ones that was major. But I guess maybe this might sound gross, not meaning to gross anybody out. If you're here and you're listening to this, you probably know. But my wife and I would call a throw-up burp, where you taste, you know, vomit. That happens. So is that regurgitation? I suppose my wife has regurgitation too then. So, and she still has it. Just rare, extremely. And again, you usually have it after you had nachos and pizza or whatever you had, that you're asking for it. But I just don't have that kind of stuff anymore. So it just, again, even if I'm not 100% better, I'm still better than I was, and I take this any day of the week. So those are symptoms. I can't think of anything else, but again, post-surgery, again, and the medication that I'm on specifically for me. I'm not a doctor, not advocating. There's my disclaimer. I'm just telling you what happened for me and what I've done, what the doctor described for, or prescribed for me. Ask your doctor questions. Maybe this helps you. I don't know. But otherwise, with the surgery and medication, combination of the two, one or the other. I don't really know. I don't really care. All I know is, again, that I've had some peace and relief in terms of these symptoms for quite a while, ever since, again, I started that medication. So if you want to know more about that, go back and watch the medication video. So hopefully this helps, and again, I'll do another video on lifestyle maybe, and exercise, and that's probably a good majority of the things I would need to talk about. So good luck everybody out there. Talk soon.